COVID-19 is on the rise in Northeast Oklahoma. KUM's Mike Mahoney spoke to the director of the Integris Grove Hospitalist program about what his team is seeing on the front lines.
There was a time when COVID-19 was on the run in Northeast Oklahoma. Over at the Integris Hospital in Grove, Dr. Sam Radaman says his team went 4 to 6 weeks without seeing a COVID-19 hospitalization. But the situation changed in mid-June, along with the virus's symptoms.
One of the things that's really been concerning is that a lot of these patients seem to have slightly different symptoms than what they did with the original COVID strain. They're getting more headache, sore throat, body aches, just not feeling well, but they're not having those really classic symptoms where they're losing smell and taste.
Dr. Radaman says he's seeing these changing symptoms among patients infected with the Delta variant and other strains of COVID-19, and says people aren't getting tested as soon as they should.
A lot of patients, I don't think, recognize that they actually have COVID. They think they have just some summer cold, and so they're not getting tested quite as quickly.
Dr. Radaman says this recent COVID uptick is dangerous to both young and old Oklahomans. He says Integris Grove is seeing a much higher number of younger patients than they have in the past, and with more severe symptoms, but that's not the only age group who should be concerned.
In Delaware County, less than 50% of the people age 65 and older are vaccinated, and that's the really highest risk group that experience COVID.
The Integris coronavirus team says the solution is simple: get a COVID-19 vaccination. Dr. Radaman says even though no vaccine is foolproof, the protection they offer and the way they lessen the severity of symptoms if you catch COVID can be lifesavers.
These vaccines are extremely safe. Yes, there are side effects, but there are side effects to every medication that you take and truly a lot of foods that we eat. These side effects honestly are less than the problems that you get if you have COVID.
In Grove, Oklahoma, Mike Mahoney, KOAM News.
The Oklahoma State Department of Health tells us, quote, vaccine hesitancy is a common issue in our rural communities. We don't see it changing anytime soon, and the virus will continue to spread. Hopefully, people are going to realize that the vaccine is working the way it's supposed to by reducing severe illness and hospitalizations. As